direct. Okay, so you should not pass it directly to another person because you can easily prick them. So what do they say? In the operating theater or procedure room, passing sharp instruments in such a way that the surgeon and the assistant are never touching the item at the same time. So this way, so passing sharp is what you know, what you call the hands-free technique, hands-free technique. So when you're passing it on, you normally hold the tip and then put it in the hand of the surgeon. So the assistant places, this is one way, assistant places the instrument in sterile kidney, basin, or in a designated safe zone in a sterile field. The service provider picks up the instrument, uses it, and returns it. So this is one way. But if you are handing it over through hand, then there's a proper way. You shouldn't face the sharp side towards the assistant or towards the surgeon. So another way is to normally actually when I load my blade on the blade handle, the dissecting here, the dissecting forceps, tooth or non-tooth, them here, then the surgeon can pick whatever they want to use. Studies have shown that cleaning a wound with an antiseptic or squeezing it does not reduce the risk of infection. So when you've, for example, been pricked, bleeding, the wound may not. Bleeding the wound does not reduce the infection. Okay? Isn't it what they teach that what you do normally bleed the wound if you've been pricked? If you're accidentally exposed to blood or other body fluids, either by needle stick, an injury from another sharp object, and a splash of a fluid, what you do, you wash the needle stick injury side or cut with soap and running water. Splashes. If you have splashes on the nose, mouth, or skin with water, you splash them or wash them. You irrigate the eyes with water or saline. Then you take post-exposure prophylaxis PEP, either for, of course, it's there for hepatitis B, for HIV, and also for hepatitis C. So hepatitis B immunoglobulin can reduce the risk of infection after exposure to blood or other body fluids. For hepatitis C, there is no post-exposure prophylaxis available. Neither immunoglobulin or antiviral drugs have shown to reduce the risk of transmission of hepatitis B. But for hepatitis B, immunoglobulin and the vaccine. So the patient, after exposure, they are given immunoglobulin and the vaccine. Do not recap, do not bend. We have talked about this. Sharp disposal in a sharp box or sharp container. HIV, we know infection prevention for HIV. Standard precautions work. These, we can read through them. These, we can read through them. We can read through this HIV surveillance, CDC guidelines, hand washing, masks. We've talked about this. Okay, PEP, there's PEP for HIV. You know, what is the PEP for HIV? We already looked at post-exposure prophylaxis for HIV. You say DTG, US3TC, and TDF. So PrEP should be started within 24 hours for HIV if you get exposed. Or no, not more than 72 hours. Then nosocomial infections, these are hospital-acquired infections. Definition, we shall look at them. Sites and causes of hospital-acquired, so you can view urinary tract through catheters, surgical and traumatic wounds, respiratory infections like pneumonias, or bloodstream. There's a nursing process, which I will not go into details. These are now teach to those my nursing students. Risk factors for hospital-acquired infections: age, elderly, or very young. Okay, because they have a weakened immune system. Nutritional status: those ones who are malnourished have a weakened system and they can easily get these infections. Stress reduces the immune system. Hereditary: certain conditions impair an individual's response to infections, like agamaglobulinemia. Okay, it should be agama. Is a rare inherited or acquired disorder characterized by absence of serum antibodies. Agamaglobulinemia. Agamaglobulinemia. I'm going to correct that. Disease process: those patients who already have other comorbidities like HIV already lowers the immune system, leukemia, lymphomas already lower the immune system, so they're easily susceptible to these infections. Then medical therapy, like use of immune suppressants like cyclosporin, steroids, other immune suppressants like steroids, radiotherapy, chemotherapy also can also lower the immune system, and so makes the patient susceptible. Nursing diagnosis: these things here for nurses, we shall look at them. Disturbed body image, risk of infection, risk for injury, imbalanced nutrition for impaired skin integrity. What needed evaluation? Needed you to look at this. Hospital bio waste management, very important for us. You need to know the color codes, which you already know. So hospital or healthcare waste is generally named and popularly known as bio waste or biomedical waste. So according to biomedical waste management and handling rules here in India, of course, I don't know if you have ours in Uganda. Biomedical waste means any waste which is generated during the diagnosis, treatment, or immunization of human being or animal, or in any research activity. So sources could be health, hospitals and health care centers, clinics, medical research centers, animal institutes, blood banks, biotechnology. Which one? Do you normally use blue? What is blue for? Color code blue. Sandra. What is color code blue for?
Do we have the brown?
Eh? Okay, so we're looking at biomedical management and handling. Category of biomedical waste. So we have category 1, category 2, category 3. And what you do with them. So category 1 and 2, you incinerate them or burn them. So category 1 is what? Human or anatomical waste, tissues, organs, body parts, or animal waste. These ones are incinerated. Category 3, microbiology, biotechnology, and other laboratory waste, disinfection, autoclaving. In category 4, waste shops, needles, syringes, disinfection by chemicals, and then autoclaving. Category 5, discarded medicines, toxins. Here is disposal in secured landfills. It is color codings: yellow, you incinerate; red, non-coordinated plastic bags. What do you do to them? Let's look at the chemical disinfectants. Chemical disinfection, autoclaving. These ones you can always read about them by your solves, landfills. Any queries? But when we come back to color coding, what does color code red stand for? Which words do we put here?
The highly infectious waste, like the
Highly
anatomical.
infectious waste, like what?
Like the anatomical waste.
Tissue, what? So those gloves maybe sold with blood and body fluids all go here. Then yellow.
Infectious.
Infectious, like what?
Use the swabs. Use the gloves.
Swab, gloves, but they're not visibly contaminated with blood, so they go here. How about where do we put used cannulas, giving sets?
In the infectious.
Then black.
Peppers is non-infectious.
Non-infectious, so papers, domestic waste, plastics, all go there. So note this. For those going to IUIU, they ask you about these color codes and then which waste goes into each of them.
What is the blue one for?
Chemical waste.
Chemical.
So those are what? Chemical waste, waste used in production of biologicals or used in disinfection. All those go into the blue.
Okay.
Drugs, where do drugs go? Expired
brown.
drugs.
In the brownie bin.
In the brownie bin, those expired drugs, isn't it? So there are others, but for us, we look at 3. Infection and infection prevention and control. We are looking at what? At 3 of them, basically. Infectious, highly infectious, non-infectious, because infection. Then the other ones are chemicals, and what those are others. That's why we're not them here. Any questions? These are methods of then we come to conclusion. Infection, we've talked about infection being very dangerous, leading to preventable death. Hospital-acquired infections are very common, but medical waste are one of the major causes of infection in hospital setting. So, responsible people like you should ensure the waste is properly collected, segregated, and transported and disposed of in proper areas. And we should also ensure we do what? We cut, we terminate, we break the chain of transmission. I'm going to ask randomly here, Robina. Are you there? Robina's microphone is not even on. Sandra. Robin, are you there? Robin, you can unmute and answer. You tell me the chain of transmission. What do you get about the chain of transmission, chain of infection? Robin has slept. Sandra, chain of infection. Once you know the chain, then you can easily know how to break the chain. Remember, in the chain, we said we have an infectious agent. Then you have what? You have in no respective order. They can be in, you have a reservoir, not so? Then you have port of exit, not so? Then mode of transmission, port of entry, susceptible host. Isn't it that?
Yeah.
You need to remember those. For those doing nursing, if you look through Robin, if you look through the books that we sent you, I hope you've already read that. It's very common question that you. I'm going to edit through these notes, and then I'll send them to you.
Okay, doctor. Thank you so much.
You're welcome. Sorry for the interruptions today. I hope next time to be better. All right. See you then.
Okay, good night.
Good night.